President Donald Trump announced on Thursday that all brand name and patented medicines imported into the United States will face a 100% tariff starting October 1, unless the manufacturer is actively building a production facility inside the country. The president has warned for months that he would target pharmaceutical imports, which escaped tariffs during his first term. Trump says the measure is designed to push drug makers to expand U.S. manufacturing and secure the supply of critical medicines. He also argues that the tariffs will help bring down prescription costs. However, healthcare analysts caution that such a move is unlikely to reduce prices for consumers. Drug makers are already reacting to President Trump's tariff plans, announcing hundreds of billions of dollars in U.S. manufacturing investments. This week, Eli Lilly revealed plans for a $6.5 billion facility in Houston, just days after committing to a $5 billion plant near Richmond, Virginia. On Thursday, Trump clarified on Truth Social what qualifies a company to avoid the new 100% import tariff. IS building will be defined as breaking ground and/or under construction, he wrote. In other words, if a company has officially started construction, its products won't face the tariff. Still, breaking ground takes time, and analysts note it's uncertain whether these commitments will meet the deadline or whether some companies already have U.S. projects underway. Eli Lilly estimates it could be up to 5 years before its new plants are fully operational. European drug giants including AstraZeneca, GSK, Novartis, Novo Nordisk, and Sanofi, all of which already have U.S. plants or plans to build them, saw their shares move only slightly in pre-market trading. But in Asia, companies like Alibaba Health, Chugai, Daiki, JD Health, Samsung Biologics, Sankyo, and Wu11 Aptech posted sharper declines, even though many may be exempt from the tariffs or have only limited exposure to the American market. A major pharmaceutical trade group warned that medicines have historically been excluded from tariffs to prevent higher costs and supply shortages. Alex Shriver, Senior Vice President of the Pharmaceutical Research and Manufacturers of America, PHRMA, said in a statement, PHRMA companies continue to announce hundreds of billions in new U.S. investments thanks to President Trump's pro-growth tax and regulatory policies. Tariffs risk those plans because every dollar spent on tariffs is a dollar that cannot be invested in American manufacturing or the development of future treatments and cures. Experts say the pharmaceutical industry's global supply chain means these new investments in U.S. facilities won't significantly reduce America's dependence on foreign ingredients or finished drugs. Production and sourcing remain spread across many countries. U.S. importers have reportedly stockpiled large inventories this year in anticipation of tariffs, according to Neil Shearing, chief economist at Capital Economics. That buildup should help cushion the immediate impact, though those cheaper supplies will eventually run out. Shearing added that the effect on exporting nations will likely be limited. The European Union is the biggest pharmaceutical supplier to the United States, and in July President Trump announced a lower 15% tariff on most EU imports, including medicines, while exempting generics. The European Commission confirmed that this 15% cap still applies. This clear all-inclusive 15% tariff ceiling for EU exports represents an insurance policy that no higher tariffs will emerge for European economic operators, a spokesperson told CNN, calling the EU the only trade partner to secure such a deal. Notably, President Trump did not include generic drug imports in Thursday's tariff plan, a key point, since experts warn that taxing generics could deepen U.S. drug shortages. Generic manufacturers operate on much slimmer profit margins, making it far harder for them to absorb new costs. Some might even pull their products from the American market rather than pay the duties. That leaves India, the top supplier of generic medicines to the United States, largely untouched for now. India provides nearly 47% of U.S. pharmaceutical needs, according to Namit Joshi, chairman of the Pharmaceutical Export Promotion Council of India. Joshi noted that the proposed tariffs are unlikely to have an immediate impact on Indian exports, since most Indian contributions are simple generics and many major Indian companies already run U.S. manufacturing or repackaging operations and continue to explore further expansion. The Trump administration has not yet released the results of its investigation into the national security risks of drug imports, a report expected to lay the groundwork for even broader pharmaceutical tariffs. Last month, President Trump told CNBC he might impose duties as high as 250% on drug imports, phased in over time. Thursday's pharmaceutical tariff announcement came alongside a 50% tariff on kitchen cabinets and bathroom vanities, a 30% tariff on upholstered furniture, and a 25% tariff on heavy trucks built outside the United States.